Those who are joining late, please help out the topic name. PCOD, polycystic ovarian disorder. Okay, that is the full form of it. So, in compared to PCOD, women with PCOS, that is polycystic ovarian syndrome, produce higher than normal amounts of male hormones. Okay, so in PCOS, polycystic ovarian syndrome, hormonal imbalance is much higher as compared to PCOD. So this hormonal imbalances causes in females to skip the menstrual periods. Okay, they will not have monthly periods, usually every once in 3 months, once in 4 months. Okay, and it is very difficult for them to get pregnant, also to keep track of their periods and to get pregnant. It is difficult for them. Apart from pregnancy and apart from these reproductive issues, unpredictable hormonal behavior like diabetes, infertility, acne, excessive hair growth. Okay, so these are the other symptoms which are very common. It is fairly common disorder, but like nobody has any exact cure of it. Okay, PCOD is very common. Okay, these cysts are also produced in majority of the women. Okay, immature cysts are left, and it is produced in majority of women. 1 minute, just give me 1 minute. Am I audible now? So PCOD is a medical condition in which women's ovaries produce immature or partially mature eggs in large numbers. Okay, and over time, usually it's the normal strategy in your ovary is that once every 1 month only one egg has to be mature. Okay, so ovulation can take place. That is the normal strategy. Okay, but when when PCOD happens, within 1 month, many eggs are, they start to get mature, but they do not usually complete the maturation process. Okay, and eggs get mature within cyst. Cyst means what? It's a hollow that is filled with fluid. Small cysts are present in ovaries. Okay, yeah, under inside which ovum will get matured. Okay, but this maturity is not complete. They get partially mature, and the cyst will just be left as it is. Okay, cyst will be just left as it is. So due to this, ovaries become large, and cysts are not going anywhere. They don't get diluted. Okay, and so many cysts happen on a monthly basis. Okay, which carry immature ovum. Okay, and they don't get diluted. They don't get broken down. So what happens? The ovary size increases over a period of time. Okay, because of the increase in the number of this fluid filled cyst. Okay, so due to which the ovaries become large, and when the ovaries become large, they secrete a lot of hormones. Okay, with the surface area of the ovary increasing, they secrete a lot of hormones. Okay, as well as androgens also. Androgen, which is the male hormone, that is also will be secreted, which will lead to when women have androgens. Usually women have androgen to in a very controlled rate. Okay, in a healthy woman's body, male hormonal hormones, androgen and testosterone, are present, but in a very controlled rate, in a very minute amount. But when this surpasses, this exceeds the controlled rate, that's when excessive androgens are produced, and that will lead to infertility or irregular menstrual cycle, hair loss, abnormal weight gain. Okay, so PCOD can be controlled by diet and lifestyle modifications. Okay, so with diet and proper lifestyle modifications, you can control the PCOD. And as soon as it is seen that women, when they control their weight, when they follow a proper sleep pattern, okay, going early to bed, waking up early, okay, when they control their diet, control their carbohydrate intake, weight management, when they get physically active, usually over a period of time, the signs and symptoms of PCOD, okay, they reduce. Okay, it is easier for women with PCOD to get pregnant, but women who has PCOS, for them to get pregnant, it is difficult. Okay, so PCOS, it is a metabolic disorder in which a woman is affected by hormonal imbalance in their reproductive ages, between that the ages is between 12 to 51. Okay, in that particular age group, because of any hormonal imbalance, uh, reproduction is difficult. Okay, and usually the eggs mature during this age group as well, and due to the increase of level, am I audible to all? So due to this increased level of male hormones, females might skip their menstrual period. They may have irregular ovulation. Okay, it is difficult for them to get pregnant, and they have abnormal hair growth over their body and face. Okay, and why it is difficult to get pregnant? Because eggs are not mature. Okay, eggs are being produced, eggs are getting matured, but they are not mature enough to be ovulated out, and when there is no ovulation, there cannot be pregnancy. Okay, abnormal hair growth on their body and face, as well as on face also, it could lead to heart disease, diabetes in long term. Okay, PCOS is a very serious medical condition, and it requires proper medical attention or surgical treatment as well. Sometimes the cyst has to be removed surgically. Laparoscopy is used. Okay, laparoscopy is a surgical option used. So PCOS is a medical condition. It is much serious. Okay. Many women who have PCOD or PCOS, they do not know about it as well. It is undiagnosed. Okay. And a group of symptoms that affects the ovulation and ovaries are ovarian cyst, increased level of male hormones. If you skip your periods or you have irregular periods, okay, that's how you these are some of the symptoms. If you are not getting regular periods, get an ultrasonography done, diagnose it, because majority of the cases of PCOD and PCOS are undiagnosed. Okay. So this is the difference between PCOD and PCOS. PCOS is rare. It is less number of people are affected by PCOS. Okay, syndrome, which is more like it requires a medical attention. PCOS requires medical attention. PCOD is very common in women worldwide. Any country you take, okay, any age group also if you take, PCOD is very common. Every woman will have 2 to 3 cysts of immature eggs. Okay. Usually the cyst will not get dissolved on its own. Okay. These converting into any cancer is very rare, but it endometriosis and all that get that also getting converted into cancer is rare. Okay. So definition: PCOS, it is an endocrine disorder of ovaries with immature follicles. Endocrine disorder, why? It has so many cysts, okay, that the ovary size is larger, and ovaries has started making producing irregular hormones. Okay, so it is an endocrine disorder. Okay, PCOD is a metabolic disorder. Okay, you control your metabolism. Your metabolism is affected. You engage in physical activity. You control your diet. Okay, do things to improve your metabolism. The hormonal imbalance will also be improved. So it's a metabolic disorder. Okay, PCOS is an endocrine disorder. It is hormonal. Presence of cyst. PCOS will have minimum number of cysts, but it is big in size. It's large in the size of the cyst is large. Okay. PCOD, you will have small cyst, more than 10 cysts in each ovaries, but it is not as large as compared to PCOS. Causes, causes are same, almost same for both PCOS and PCOD. Genetics, lifestyle, eating habits, mental health, okay, insulin resistance, inflammation, weight gain, weight fluctuations. Okay, you cannot reverse PCOS. Once you are affected by PCOS, you cannot reverse it. PCOD can be reversed with medication or even with lifestyle changes. You can reverse the symptoms of PCOD. Okay. Through blood test, you can only know the imbalance in hormones. Okay, which hormone is running high, which is low. Okay, what is the level of androgen, estrogen? These information you will get from blood test. But to see the actual size, okay, to see the actual size of the which ovary is affected or what is the size of the cyst, okay, to see all these things, it's better to do a ultrasonography. Okay. Treatment of PCOS: diet control, exercise, lifestyle changes, okay, medication. These can work. For PCOD, diet, exercise, medication, and surgery can also work. Okay. Lifestyle changes is necessary in both of them. Complications of PCOS: very difficult to get pregnant, risk of diabetes, high blood pressure, obesity, endometrial cancer, very rare, but endometrial cancer. Endometrial cancers chances are higher with endometriosis, but with PCOS it is still rare. Okay. Easy to get pregnant in PCOD with medical aid. maybe IVF therapy will be required, or hormone balancing therapy, hormone replacement therapy will be required. But it is fairly easy to get pregnant with PCOD as compared to PCOS. Oral contraceptive pills are given for majority of the hormone balancing kind of reproductive disorders in females. Okay. PCOS. In PCOS, surgery is required. And what are the most common signs and symptoms of PCOD or PCOS in females? It is irregular menstruation, oligomenorrhea. Sometimes it is amenorrhea. Amenorrhea means absence of menstruation, no menstruation at all. 6 months also you will go without menstruation. Heavy menstrual bleeding, that is menorrhagia. Okay. It's every case of PCOD may have different kinds of symptoms. Okay. Some women may suffer from too little menstruation, no menstruation. Some women may suffer from heavy menstruation. It is very subjective. Menstruation is very subjective. Okay. And in some cases of PCOS, you may have to remove the ovary as well. Okay. That surgery is required to remove the affected ovary. That is the ovary which is affected more, that has to be removed. Okay. Oophorectomy, that is the surgery done. In PCOD, you don't require to remove any ovaries. You can just burst off the cyst. You can excise off the cyst. That is easily done laparoscopically. But some PCOS, okay, in syndrome, surgery may be required to remove one ovary. Excessive hair growth on face, body, back, belly, chest, acne on the face, chest, upper back, okay. Weight gain, difficult to lose weight, metabolic disorders, hair loss, okay, hair on the scalp, it gets thinner and thinner and can fall out. Skin gets darker, usually near the jaw, the fold, okay, like neck fold, groin area, under the breast, okay, this area, the skin get darker and darker. These are the common signs and symptoms. In heavy menstruation, it's recommended to make sure your iron levels, okay, are normal. You may have to take iron supplements. In teenage years, oophorectomy is not done. You have to wait till the girl turns into an adult to see the see what level, what stage of PCOS is it, how aggravated it is. Okay, and based on that, a decision is made. Okay. Next, the causes of PCOS. Exactly how women get affected by PCOS is not known. However, some factors are associated. Okay, we see all the diagnosis with PCOS. This common factor is seen in a majority of the cases. So, excess insulin production. This leads to insulin resistance. What is insulin resistance? Your body is producing insulin, no doubt, but your cells, your body cells are not responding to insulin. Okay, because when your body cells respond to insulin, okay, the body cells will open up their pathway to get glucose inside the cells and out of the blood. Okay, that is the main function of insulin. How does insulin make the blood sugar level go low? Because cells respond to insulin. As soon as the cells see insulin gets on the cells receptors, cells will open up the pathways to collect more glucose in within the cell, so that automatically the blood in the glucose in the blood comes down. Okay, what happens in insulin resistance? From the name itself, you will see your cells, your body cells are resisting insulin. How much ever insulin is coming on the cells and it is getting attached on the cell receptors, cells are not opening its pathways to get more glucose inside. Okay, the blood glucose level will also stay high. Insulin levels will also stay high because pancreas will think, I think we require more insulin to get the blood glucose level down. So pancreas will start secreting more and more insulin, but it is not responding. Your cells are not responding to insulin. That is insulin resistance. So excess insulin levels in the body might increase androgen production. Okay, that causes difficulty with ovulation. Excess androgen production, the ovaries produce abnormally excess androgen hormones that can lead to acne, hirsutism. Hirsutism is too much of hair growth on the face. And body. Low-grade inflammation. As per recent study, females with PCOS, they have low-grade inflammation that causes increased level of androgen production. And low-grade inflammation is also associated with obesity. Okay. Insulin resistance can be reversed with diet control and exercise. When you move a lot, when your body is using a lot of energy, automatically the cells will have the need to have more glucose for more energy. So the cells will start responding to insulin. Okay, with exercise and with diet changes, okay, insulin resistance can be reversed. As per recent studies, females with PCOS are having low-grade inflammation that causes increased level of androgen production, which can lead to blood vessels or heart problem as well. Obesity also leads to this low-grade inflammation because it is difficult for women to lose weight with PCOS. Okay, and it piles up. Okay, all these causes will pile up on each other. Heredity, first first line of female relatives. Okay, like if the mother has PCOS, there are high chances that the daughter may also suffer from PCOS. If one sister has PCOS, high chance the other sister may also suffer from PCOS. Okay, so genetics has a correlation. Usually it runs in families as well, PCOS. Coming to the complications of PCOS and PCOD problem. No. Abnormal uterine bleeding. Okay, one complication of PCOS, abnormal uterine bleeding in between of any in between your menstrual cycle. Okay, bleeding can take place. Okay, recently you have finished your menstruation, again within the next 1 week or next 2 weeks, again you may start menstruating. Okay, that is abnormal uterine bleeding. Then infertility or hypertension, infertility, very common. It is very difficult for women with specific, especially with PCOS, to get pregnant. With PCOD, with medical aid, you can still get fertility treatments done and you can get pregnant. Yeah, maternal history is responsible for PCOS. Type 2 diabetes. As I mentioned about insulin resistance, okay, insulin resistance would lead to increased risk in type 2 diabetes. Preterm labor and premature birth. Even if you have a successful pregnancy, there are high chances that it would not reach the term. Okay, you may have to deliver the child in preterm.
okay, or the child, you may have a premature baby. Metabolic syndrome, the risk for high blood sugar, high blood pressure, heart disease, diabetes, stroke, okay, risk for these conditions are high with any woman who has a history of PCOS or PCOD. They have a higher risk of getting diabetes, early hypertension, cardiovascular diseases, and all the risk associated with cardiovascular diseases. Okay. The non-alcoholic steatohepatitis, that is non-alcoholic fatty liver. Okay. Non-alcoholic fatty liver. As I mentioned, uh, along with dietary changes, your protein intake has to be high. Okay. Or if you are having a lot of junk food, definitely you may not receive enough amount of good quality protein, because of which body is not preparing enough lipoproteins. If your body does not prepare any enough lipoproteins, there is no one that can move the protein around, okay, in and around your body. So what happens? The fats, there is nothing to move the fats around the body. Fat will get deposited on the liver and it could lead to fatty liver. Even if you don't have alcohol issues, okay, if you don't do any substance abuse or alcoholism, you can still get fatty liver, and that is called non-alcoholic steatohepatitis or non-alcoholic fatty liver. Okay. Thyroid gland is responsible for metabolism. If you have issues with metabolic disorder, somewhere or the other, thyroid gland will also be involved. In PCOS, thyroid issues will be more common because it is an endocrine disorder. Okay. Then with depression, many women end up experiencing depression and anxiety due to unwanted hair growth and other symptoms. It is very common. And also not able to become pregnant or menstrual issues. Okay, that could also lead to depression in women. Weight issues, body image. Okay, so these could also lead to depression in women. Then we have sleep apnea, which means you are not able to breathe properly while sleeping or lying down. Okay. To breathe properly, you may have to have 30 to 45-degree rise in your head level. Okay. Like in a cardiac position. Women who are overweight, they are also not able to sleep properly, breathe properly when they lay down. Okay. When they are in the sleeping position. Endometrial cancer, because of thickened uterine lining, because what happens is that if ovulation is not taking place, if ovulation is not taking place during the time of ovulation, your uterine layer, endometrial layer of the uterus, that is a very cushion kind of a layer. Okay. So the uterus is getting ready for pregnancy every month. Okay, uterus is getting ready for pregnancy every month. It is thickening its endometrial layer to accept a fertilized embryo. Okay, every month. But ovulation is not taking place. Only if ovulation takes place, the second part of menstrual cycle can begin. That is the luteal phase, where progesterone will make sure that the stop in progesterone can make sure that the uterine layer will shed off as menstruation. But what happens here is that ovulation is not taking place. There is no hormone left that can help the uterine layer, which was ready for pregnancy. There is no hormone left that will shed this layer down. Okay, so every month it gets thicker and thicker. Uterine layer is getting thicker and thicker. Okay, and that is the risk of getting endometrial cancer. Okay.
So to understand this, you should understand the basic menstrual cycle. Okay. In the first phase of menstrual cycle, your uterus is getting thicker and thicker. Okay, your uterine layer, endometrial layer, the most inner, inside layer of your uterus is getting thicker and thicker. It is getting a lot of blood vessels, soft tissues. Okay, so that it can receive a fertilized egg. But egg will be fertilized only when there is ovulation. In case of PCOD or PCOS, ovulation will not take place because eggs are immature. When eggs are immature, it will not be released. Okay. So when the eggs are not getting released, how will the second phase of menstruation start? Ovulation has to take place. First is the follicular phase when the uterus is getting thicker. Then is the ovulation phase when ovulation is happening. Then the luteal phase of menstruation. After ovulation, luteal phase will start. But when ovulation is not happening, luteal phase will not start. In luteal phase, in the end of the luteal phase, the uterus lining, which was thick, which was ready to accept a fertilized embryo, that is no longer required and it will shed off. Okay, and it comes out through the vagina as periods. Okay, but when ovulation is not taking place, how will the uterus go into the luteal phase where shedding has to take place? Okay, so every month the uterus is getting thicker and thicker. The endometrial layer of the uterus is getting thicker and thicker, but there is no phase left in the menstrual cycle to help shed this layer off. Okay, so this thickening of the uterus lining, that could become cancerous. Very rare, but it could become cancerous. Is it clear to all? You have to understand a normal menstrual cycle for that. Okay, normal menstrual cycle, we will take it later. Just understand there is three phases: follicular phase, ovulation, and then you have the luteal phase. Only if ovulation takes place, luteal phase can happen. Okay, because egg is released, but the follicle that was helping the egg to mature, that follicle will stay back in your ovary. Okay, it's like an eggshell. Imagine an egg. Okay, the inside of the egg is released. Egg yolk or albumin is released, but the shell that is remaining, that is still in your ovary, and this shell is what prepares progesterone hormone. Okay, so when the egg has not been released, it is still in the shell, it is still in the follicle, there is no progesterone hormone. When there is no progesterone hormone, how will the next period come? It will not come. Okay, that's the reason why you keep skipping the periods. How long it will take for the endometrial lining to get cancerous, it depends. Okay, we cannot say that. It depends. It is very subjective. It can turn cancerous in 1 year, 3 months, 6 months. It depends. Is it clear to all? Then miscarriages, even if the woman gets pregnant with PCOD or PCOS, there are high chance of spontaneous abortion. Okay, spontaneous loss of pregnancy, that is what we call as miscarriage. Okay. Luteal hormone, either through hormonal replacement therapy, okay, you can give, but it is important that ovaries produce it, because ovaries produce it in exact dosage how the body requires. Okay. Diagnosis of PCOD and PCOS. Pelvic examination, physically, you can check the reproductive exam organs for any masses, abnormalities, or any growth, any tumor-like growth. Okay. Palpations can be done. It is done by the physician. Gynecologist will do this pelvic examination. Blood test. Blood test will help to understand the hormone levels. This includes fasting lipid profile test also to check the level of cholesterol. Okay, do you have a high density lipoprotein, triglycerides, low density lipoprotein? Okay, glucose tolerance test. These tests can be done. Imaging test, that is your ultrasonography. Okay, sonogram. USG test can be done to see the size of the ovary, lining of the uterus, how many cysts are present in the ovaries, to check that. Sonography is done. Then gynecologist may recommend some additional test also. That is periodic monitoring of blood pressure, regularly checking your glucose, cholesterol, triglyceride levels, okay, LDL, HDL levels, screening for anxiety, depression, okay, screening for any obstructive sleep apnea, that is sleeping disorders. Coming to the lifestyle modifications and some remedies for PCOD and PCOS. First of all, you have to maintain a healthy body weight. Okay, it improves the metabolism. Limit carbohydrate consumption. Okay, that also unhealthy carbohydrates. Limit simple carbohydrate consumption. Okay, do regular exercise and be active, because when you do regular exercise and when you are physically active, your body cells will actually need more glucose. Okay, when the body cells require more glucose, automatically the blood glucose levels will come down, because cells are taking the glucose away from the blood. You don't have to go through insulin resistance then. Treatment for PCOD problems and PCOS. It focuses on managing your individual problems such as irregular periods, obesity, infertility, acne, hirsutism. Okay. Along with that, the symptomatic treatment has to be done because it improves the body image. And treatment usually starts with lifestyle changes like weight loss, diet, exercise, which we have discussed right now. And losing, if you are successfully losing just 5 to 10% of your body weight, that can also help you regulate your menstrual cycle. Okay, so you don't have to target, you do not have to have big targets of weight loss. Okay, if you're overweight or slightly obese, even if you lose 5 kilos, okay, just 5 to 10% of whatever is your body weight, if you're losing that, that can still bring back your normal menstrual cycle. So treatment given for PCOD and PCOS, it completely depends on the symptoms like hair growth, acne, metabolic disorders. Regulate the menstrual cycle by medication, or oral contraceptive pills are also given here to regulate the menstrual cycle, to treat hormonal imbalance, insulin resistance. Ovulation induction is done, okay, to induce ovulation, again through oral contraceptives and injections. Infertility treatment is done through fertility drugs. Gynecologists will take care of it. Obstetrician or gynecologist will take care of it. Lowering the excessive hair growth. Laser treatments. Laser hair treatments can work here. Skin treatments for acne and pigmentation. Okay.
Laparoscopic procedure, ovarian drilling, destroy androgen producing tissues in ovaries. That is a laparoscopic surgery. Okay, ovarian drilling. So with that, the cyst which are present in the ovary, that can be destroyed. You just have to burst it open and take away the fluids. Only if the PCOS patients are not responding to oral medications or with lifestyle changes, a positive response is not seen, then we go for the laparoscopic procedures. Any diet that can help you to lose weight can help your condition with PCOD and PCOS. Some diet may have advantage over other, okay, like intermittent fasting and all, okay. Weight loss can improve the cholesterol levels, lower insulin, reduce heart disease, diabetes risk. 20 minutes of moderate intensity exercise at least 5 days a week can also help a woman to lose weight. Losing weight with exercise improves ovulation, insulin levels, as I mentioned. Insulin resistance can be cured with physical activity. Best treatment for PCOD and PCOS will consist on-time diagnosis as soon as possible if you're diagnosing it. Okay, if a girl child, even if a teenager is complaining of heavy menstruation, painful menstruation, take her to a gynecologist, get her sonography done, ultrasonography done. Okay, when you start treating it as early as possible, the body will respond well to treatment. Maintaining healthy lifestyle is also equally important to treat any hormonal imbalance. So that's all for today for PCOD.